Gentlelady yields back. Recognize Mr. Bilirakis, 5 minutes.
Thank you, Mr. Chairman. I appreciate it, and this is really a great hearing. Thanks for holding it. So again, H.R. 7189, the Congenital Heart Futures Reauthorization Act of 2024. I'm one of the co-sponsors, the lead co-sponsor, and I want to thank my colleagues again for co-leading Soto, Carter, Schiff, Salazar, and Cardenas. This critical legislation will ensure the continued investments needed at HHS to understand and assess the lifelong needs of congenital heart disease, or CHD. Since this program was originally created, we've seen the needs of patients living with CHD evolving over the years. In the past, you've heard me talk about Nicholas Baskin, who was born with congenital heart disease and required heart surgery at just 2 days old. While I'm glad to report that Nicholas graduated from high school last spring and is pursuing music writing, his decision to stay in the Chicago area for college was certainly affected by his access to adult congenital heart care. Other more rural areas, unfortunately, do not enjoy the same access to adult CHD care, and this transition from pediatric to adult care for CHD patients is a critical period that requires specialized coordination of care, especially that there are now more adults than children living with congenital heart disease because of your great work. And this isn't just in the rural areas where we have a lack of adult congenital heart physicians, even in my area, the Tampa Bay area, which is not considered rural. Dr. Tomaselli, I want to thank the American Heart Association again for their support of H.R. 7189. Do you have any suggestions for how we can expand and strengthen the congenital heart program to focus on the unique lifelong needs for adult congenital heart patients through workforce development training measures, particularly when we know there's a shortage of cardiology care nationwide? Now, I know you addressed this, but I want to give you an opportunity to expand upon that, sir.
Representative Bilirakis, thank you very much for the support of this bill. Well, the American Heart Association appreciates your work on this. And as you recognize, the workforce shortage is not unique to this particular problem in cardiology, more in medicine more generally. And I think one of the goals of some of these bills is to provide education about some of these conditions. And we find that actually getting into schools and engaging people early on what needs to be done, for example, in a cardiac emergency, or what are the components of these bills, allows us to draw in younger people who might be interested but don't know it yet, that they might be interested in a career in medicine or biomedical research. So this legislation not only provides care, education, and training to those providing care, but an opportunity and a stepping stone for others who might want to be engaged to get engaged. I also think it's really important to recognize that regardless of the medical problem, team care is essential, and making sure that we not only recruit physicians, but we recruit other allied healthcare providers who provide an important component of care, particularly at the transitions, and oftentimes are the ones who are following patients through that transition from childhood to adulthood. And one other thing that I think is essential is that really taking advantage of the fact that we can now meaningfully do some things in telemedicine and actually allow primary care providers or non-specialized providers who are out in the community to communicate with the specialists who might not be available immediately, but would be available to provide consultation and help with management of patients. So I think this fully expands the whole, not only degree-bearing providers for healthcare, but also expands the regions in which this care can be provided. So I think all of these things, and they're all components of the two bills under consideration, and by the way, the AED access bill as well.
Thank you very much. Dr. Pike, I'm thankful you're here. I've been such a strong advocate for Alzheimer's patients. Something that's clear and really dear to my heart. My mom is suffering from Alzheimer's disease now, and the caretakers, as has been said, it's a really what a burden on the caretakers. I was proud to recently co-sponsor Representative Tonko's NAPA Reauthorization Act, which extends the National Alzheimer's Project Act. And in fact, we modeled Representative Tonko and I modeled our legislation, the National Parkinson's Plan, after the Alzheimer's Plan due to its accomplishments. Can you provide specific examples of these successes, how the National Alzheimer's Project has helped advance Alzheimer's research and care, and why this model has worked at the federal level, sir? I know you don't have a lot of time, but this is really important.
It is important, and thank you for asking the question. I will try to keep it brief. You know, the NAPA reauthorization is incredibly timely right now as we look at the progress that we are making in this disease. We have treatments for the first time. We have diagnostics that are going through the pipeline. And part of that is because of the 7-fold increase that we have seen in research funding coming out of NIH over the last 10 years. Being able to coordinate across federal committees, federal departments, and agencies is incredibly important to continuing that progress with the NAPA reauthorization, and take what we have learned from the last decade of science, including on risk reduction, and fold those new pieces of information and new agencies into the Act.
Thank you very much. I guess I ran out of time and went over them. I apologize, Mr. Chairman. I yield back the balance.
I'll take it off your time for the next hearing. No, I'm just kidding. That's a joke.